Hello, everyone. My name is Nicole Merkowitz. I'm a third-year occupational therapy student at the University of North Dakota, and my capstone project is titled Sex, Drugs, and Rockin Referrals, an interprofessional guide for young adults with cancer. So before I get going too far, I think it's important to explain the meaning behind the title. This product is an interprofessional referral guide for young adults focused on health promotion and management with an emphasis on sexual health. It's intentionally named to be playful and also challenge social norms. So this table gives a brief overview of the words in the title, the need, and then the solution as well. So the first part of the title is sexual health conversations need to be happening consistently. And then to address this, I used the recognition model within my product, as well as created an OT-directed in-service. The next part of the title is drugs, and this refers to the medications and treatment methods used for cancer treatment. A lot of these drugs and procedures and other medications have long-term side effects that affect overall health management as well as sexual health. So then to address these side effects from the medications, I created a referral checklist that will help healthcare professionals identify patient needs and then provide holistic care and patient-centered care for them. Rockin Referrals, an interprofessional guide. This is to provide patient-centered care in a team environment because that is definitely a need throughout all care centers. So the solution is to provide an interprofessional team diagram and roles diagram, as well as use the referral checklist. And lastly, young adults with cancer. AYA patients with cancer have unique needs compared to pediatric and older adults. So then this product is specifically designed to meet the needs of patients ages 15 through 39. And then the objectives of this presentation include understanding the unique needs of adolescent and young adults with cancer, and then learn about the purpose of sex, drugs, and Rockin Referrals, an interprofessional guide for young adults with cancer. So then my whole project was guided by this problem statement. According to the National Cancer Institution, 89,000 AYAs are diagnosed with cancer each year. This population makes up about 5% of all patients with cancer in the United States, so it's a pretty small population. However, 56 through 75% of AYAs who could benefit from occupational therapy do not receive services. So that stat just kind of illustrates how important it is to provide services for AYAs, no matter what service it is, whether it's OT, social work, dietitian, all those services are important for this age group. So then the first part of my project was to complete a needs assessment. I observed various disciplines such as social work, oncology nurses, palliative care, medical oncologists, all those kind of disciplines that work together at the cancer center. Then I also had conversations with stakeholders, so young adult patients, oncology, nurses, just to kind of get a feel of how I can help them and what the real needs of the facility are. And then I attended young adult patient committee meetings, again, to gain perspective of what would be most beneficial for the site and the population. And I also observed OT lymphedema evaluations. Lymphedema is a long-term side effect that many cancers face, and occupational therapists and physical therapists can be lymphedema certified. And then I completed a literature review. And these are some key findings that I found. So unique challenges for this age group include developmental milestones and models of care. So I look specifically at the ages of 15 through 39, and in that age range, a lot of pivotal life transitions happening. So whether it's graduating high school, going to college, finding a job, dating, getting married, raising a family, those are all things that typically happen within that young adult and adolescent age range. And then it's common for young adults to be diagnosed with a pediatric cancer, but still be treated in a pediatric center, or a center that is caters mostly towards older adults. But because of those developmental milestones, the model of care doesn't typically meet the needs of young adults. Then side effects from treatment impact occupations. So anything a person that needs and wants to do and they're going through cancer treatment, it's typically affected by the treatment methods. And third, healthcare providers are typically uncomfortable talking about sexuality. This can be due to social norms, our own thoughts and feelings about talking about sexuality and sexual health. That plays a huge role into how often these conversations about sexual health are happening in the clinical setting. Then lastly, there is a need for improved interprofessional collaboration. All right, this slide gives an overview of the occupations that are impacted by cancer treatment. So again, an occupation is something that a person needs and wants to do. So all of these are affected. My particular product focuses on developmental transitions, sexual activity, and health management. So then, based on the needs assessment and my literature review, I created the product titled Sex, Drugs, and Rockin Referrals, an interprofessional guide for young adults with cancer. So it's an interprofessional referral guide focused on health promotion. And it's a broad topic for health promotion, but it focuses specifically on sexual health, on the side effects from procedures and medications, and ADL and IADL concerns. So the purpose statement and objectives for this product include enhancing health promotion for AYAs through interprofessional collaboration and prehabilitation by improving consistency of sexual health conversations, addressing side effects of medications and procedures, providing referrals within the interprofessional team. So the goals and benefits of prehab. Prehab is just a proactive approach for rehab. It's providing education about symptom management, hopefully before a patient experiences side effects. Education about symptoms is helpful throughout the care continuum. So the overall goals of prehab include improved physical functioning, improved psychological functioning, health outcomes, and improved interprofessional collaboration, while also reducing treatment-related impairments, the risk for comorbidities, and overall healthcare costs. So then I used two theoretical frameworks while creating this product. The first one is the Ecology of Human Performance model, also known as EHP. It's not a specific OT frame of reference. It's actually supports interprofessional collaboration, and that's why I used it. And the second one is the recognition model. And this model is used for the interprofessional team to help guide and navigate conversations about sexual health with patients. All right, so this is my table of the core concepts of EHP applied to the interprofessional team. So the person is the interprofessional team and their roles. The tasks of the interprofessional team include initiating conversations about sexual health, addressing patient needs, providing referrals, and then the context includes the overall collaboration of the team. Areas of need include sexual health and activity are often overlooked in the clinical setting, and the long-term effects of treatment impact overall health promotion as well as sexual health. The barriers that the interprofessional team could face include a lack of understanding, a low number of referrals for patients, and again, sexual health is not consistently addressed. However, the interprofessional team is supported by having various disciplines to provide holistic and patient-centered care. So this slide describes the product that I made. Again, it is an interprofessional referral guide for health promotion in young adults with cancer. It has 5 main components, including an interprofessional team diagram, an interprofessional role diagram, Let's talk about sex as an introduction to the recognition model, then an OT-directed educational in-service to the interprofessional team, and then a referral checklist. So this is the first diagram I made. It's establishing the interprofessional team meant to support collaboration, and it's a reference that can be used for the team while making referrals. So the main disciplines I have listed are oncology, rehab, sexual medicine department, healing center, dietitian, social work, and pharmacy. And within those main branches are other disciplines that fall within them. All right, and then the next one is supposed to complement the other one by providing a brief description of the various team members. So I have them color coordinated in different colors. So the teal color is for rehab. Purple is the sexual medicine department. The hot pink is social work. Healing center is periwinkle. Pharmacy is magenta. Palliative care is a forest green color, and the dietitian is lime green. And lastly, the RN cancer coordinator is in light blue. Again, this is meant to be a quick reference for the interprofessional team while making referrals. So then, since I'm an OT, I think it's important to address how OT can help AYAs with cancer throughout the care continuum, so all the way from diagnosis to end of life care. So some things that OT can do during the diagnosis timeframe include coping strategies and a focus on prehab. And then treatment, we can work on self-management strategies, ADLs, IDLs, and adaptive equipment if needed. And then survivorship, we can give ideas for environmental modifications as the young adult returns to work and school. Self-management strategies, again, just to manage those symptoms and the long-term side effects. And then lastly, end of life care. OTs can work with the patient to establish legacy completion, family training, and adaptive equipment. All right, so then the next part is let's talk about sex introduction to the recognition model. So the included materials in this chapter include the recognition model handout and an OT-directed in-service about sexuality and cancer care for young adults. So this is a QR code for my OT-directed in-service that I made. It goes more in depth than what I will explain about the recognition model in this presentation. It's about 7 minutes long, and it gives an overview of the recognition model and the intervention strategies used. So again, this will be an abbreviated version for the recognition model, but the first stage is acknowledging that the patient is a sexual being and therefore has sexual needs. Stage 2 is gathering permission to talk about sexual health with the patient. At this stage, the patient could say, no, I don't want to talk about that. And then you would just end the conversation there. Or they could say, yeah, you know what, let's have a conversation about that. And then you would move into stage 3 and explore their concerns about their sexual health or other things that they have concerns with. And then stage 4 is addressing concerns within the interprofessional role, whether it's providing more education or gathering more information. And then stage 5 is providing a referral. For this purpose of the project, I recommended a referral to sexual medicine department or occupational therapy. So this diagram illustrates how OT can address sexual activity. So it's very common for cancer-related fatigue to be the main factor that affects sexual activity with patients who have cancer. So the intervention strategies that OTs can provide include different positioning options, energy conservation strategies, communication strategies, adapting and modifying tools, and then different exercises and stretches for range of motion, endurance, and strength. All right, and then the sexual medicine department is made up of many different disciplines that work together as a team. So beginning with OBGYN, they focus on women's health. The neurology specializes in urinary tract and reproductive conditions. A certified sex counselor and advanced practice registered nurse. She provides counseling and treatment of conditions that affect sexual functioning. And then her intervention strategies can include education, lubricants, dilators, meditation, and mindfulness strategies, counseling, and medications. And then pelvic floor physical therapy works to strengthen the pelvic floor muscles. And this can be done through manual therapy, exercises, dilators, stretches, mindfulness strategies, and pain management strategies. So this is the last part of my product. It's the referral checklist. And again, I applied EHP to it. So the person would include any young adult patient ages 18 through 40 who is undergoing cancer treatment. And again, it works with the interprofessional team. So the young adult will complete the checklist and the team will provide referrals. The interventions include establishing referrals for young adults, establishing the areas of need, and then restoring the skills needed to participate in meaningful tasks. And then by providing referrals, we hope to prevent negative outcomes by initiating conversations about patient needs. So then included in the last part of my product is the referral checklist introduction, and then the referral checklist for young adults. And then there's 2 establishing referrals for young adults. It's a key that the provider goes through for young adults with cancer in general, as well as a specific one for young adults with breast cancer. All right, and here's a brief intro to my referral checklist. The purpose again is for health promotion. These forms address various procedures, medication side effects, NADL and IADL concerns. It would be best for the young adult to complete the form 3 different times throughout treatment. First at diagnosis, then at treatment, and then finally at survivorship. 3 times would give the opportunity to establish a baseline and then monitor changing needs throughout treatment. This form will be uploaded in my chart to make it easy for the young adult to fill out, and then for the healthcare provider to access and review as needed. It's a pretty short checklist. It will only take about 2 to 3 minutes to complete. So while the patient is sitting in the lobby waiting for their appointment, it would make sense for them to use their phone and complete the checklist. So this is how you use it. So once the form is completed, an oncology nurse will initiate a conversation about sexual health. This should happen regardless if it's a concern from the patient. And then you should also address the side effects from procedures and medications, discuss patients' concerns, and then provide referrals within the interprofessional team as needed. So then this is the first part of it. It's the procedure section. So I have different procedures listed, chemotherapy, surgery, and radiation. And then for surgery and radiation, I have the different locations listed. I listed them because based on where surgery and radiation take place, it impacts sexual functioning as well as other side effects as well. So this is the medication portion. I have different side effects listed, and it asks about what side effects do your medications have. So I grouped the side effects together based on similar symptoms, and then yes, no, or unsure. If the patient checks unsure, it provides an opportunity to have that conversation about health literacy on things that they could be expecting or not to expect. And then lastly, if they are currently experiencing those symptoms, just a simple yes or no. All right, and then the last part is addressing ADLs and IADLs. So it says, please circle any of the following areas you have concerns with currently. And it gives a whole list of options. So based on the things that they circle or check, it could trigger a referral to the specialty that can help address those things based on their concerns. And then lastly, it provides an area to provide additional comments about concerns if needed. So then the next part is my provider checklist, key to use when establishing referrals. So the person in this case is the ordering provider and the disciplines they refer to. Person factors that are addressed are side effects that impact medications, procedures, and ADLs that are impacted. Context referrals are available based on the setting, so whether it's an inpatient setting or an outpatient. And then again, we hope to prevent negative outcomes by providing referrals and improve patient side effects and promote engagement in meaningful tasks. So then this is what it looks like for the provider. So this is the form for young adults, just in general. So will the patient have a procedure in the pelvic region? If yes, provide a referral to the sexual medicine department or occupational therapy according to their need. So I listed all the ordering providers and then the disciplines that they can refer to, as well as the setting. So pretty explanatory. And then this is what it looks like for breast cancer patients. So it's the same concept. I have the ordering providers, the disciplines referred to, and then the setting. I added a surgeon to the ordering providers because they're typically the ones to provide a referral to the lymphedema therapist, which is something to really consider with breast cancer patients, is that lymphedema is a huge risk and side effect, both short-term and long-term, to be aware of. And then lastly, the next part is a medication. So address potential side effects to promote preventative care as early as possible. And provide a referral and or education. So again, I have all the same side effects listed as I did for the patient one, grouped together, and then just if the patient is experiencing those side effects or not. And then we have the referral checklist for the provider for ADLs and IDLs. Same concept, I have the ordering provider, the discipline referred to, and then the setting the disciplines are available in. All right, so then how to use this project. I think it would be best to start with young adults with breast cancer. My reason behind that is that there is an established team of breast cancer coordinators who are familiar with the side effects due to breast cancer. And they may be more comfortable addressing sexual health with patients just due to their experience. In addition, patients with breast cancer make up a large population at this particular cancer center. So it would be both starting with nurses who are comfortable, who may be more comfortable addressing sexual health, while also reaching a large patient population. And then once comfortable using the checklist and having those conversations about sexual health, we can work to expand the use of the project with young adults in general. There are some limitations to this project. I'll go through them real quick. So AYAs make up a small portion of patients with cancer, which I talked about in the beginning. So the opportunities to use this checklist may be limited. It's also possible that the patients will refuse a referral just based on exhaustion and already scheduled appointments as well. It's also important to consider the logistics of referrals. So for example, the OT department specializes in kind of neuro and TBIs, and there's only one OT who specializes in lymphedema therapy. So just kind of keeping that in mind when providing referrals. And then there are some external factors that play a role in addressing sexual health. As healthcare practitioners, we bring our own experiences, our values, and morals into everyday interactions. So the comfort level that we have can impact how often and consistently we are addressing sexual health of patients. Again, this product has not been piloted, so I anticipate that there are some changes and maybe some slight tweakings that need to happen in order to make it the most useful. All right, so then my recommendations for the future. I would recommend adapting the referral checklist to be used with older adult patients once we get the young adult patients familiar and comfortable with using the product. And it's also important to consider mental health referrals. As we know that cancer is not just a physical thing, it also affects mental, emotional, and psychosocial aspects of the person as well. This would be most beneficial to use an electronic format for patient and the healthcare provider to promote ease and then access to it as well. And it would also be good to have additional culture and diversity training for healthcare providers to meet the needs of LGBTQ patients. And then lastly, we can assess outcomes through patient satisfaction, the overall number of referrals given, and then interprofessional team reflection. All right, so then as a summary, a cancer diagnosis in adolescence and young adulthood affects many occupations and developmental milestones. Interprofessional collaboration is important for patient-centered care and health promotion. And lastly, sexual activity is an ADL and needs to be addressed consistently in clinical settings. All right, and here are my references that I used in this presentation. Thank you for listening.